क्या है ये हार्ट अटैक और अपनी हार्ट हेल्थ का ध्यान हम लोग कैसे रखें, इसी बात की अवेयरनेस स्प्रेड करने के लिए हमने स्टार्ट की थी एक बाइक रैली। फाइनली एट बाइकाथॉन गाइस, एंड यू कैन सी मैं ठीक से सोया नहीं हूँ कॉज ऑफ एक्साइटमेंट, एंड सारे के सारे डॉक्टर्स अवेलेबल है। लेट्स सी, विल आस्क देम इंपॉर्टेंट क्वेश्चंस की हाउ टू टेक केयर ऑफ हार्ट एंड एक्सेट्रा एक्सेट्रा। थोड़ी देर में देखते हैं व्हाट शैल वी डू। Oh my god, bro, this is crazy. And we will stop at KCD College. I'll see you there, guys. Can you see the crowd? Bro, literally. Look at the rally. SDM में I've never seen this much bikers.
SDM ನಾರಾಯಣ ಹಾರ್ಟ್ ಸೆಂಟರ್ ಧಾರವಾಡ ವಿಶ್ವ ಹೃದಯ ದಿನಾಚರಣೆಯ ಅಂಗವಾಗಿ ಹಮ್ಮಿಕೊಂಡ ಈ ಬೈಕ್
Can I get one? भाई किसी का दिल उड़ गया। अभी देखो भाई, वीडियो यहाँ से बहुत बोरिंग होने वाला है, लेकिन अगर तुमने 10 मिनट सर्वाइव कर लिए तो यू विल नो अ लॉट ऑफ थिंग्स अबाउट हार्ट अटैक। पॉज द वीडियो एंड सी द क्वेश्चंस, बिकॉज यही क्वेश्चंस मैं डॉक्टर से पूछने वाला हूँ।
Influencer?
Yes, sir. Like I teach people common health science, sir, so that they can take care of themselves in home as well, sir. So that they don't Google it and stuff themselves up in a sticky situation, sir. Today I'm with Dr. Raghu Prasad, sir, works in SDM Medical College, who also is doctor in Narayan Ridalaya Healthcare Center. So I'm going to ask a few simple questions that sir is going to answer. Tips for a healthy heart.
Good morning, first of all, to everyone. The most important part of maintaining your heart health is to keep yourself happy. So keep smiling and keep laughing with others. Important aspects of maintaining one's heart health is balanced nutrition, regular physical activity, screening for the risk factors for heart disease, which includes diabetes, high blood pressure, that's called hypertension, cholesterol issues, and lack of physical activity, and family history of heart disease. Most important thing is to recognize the early warning signs of heart attack and heart diseases.
At what age should we start to get a heart regularly checked, sir?
The most important part of this thing is, like, if anybody has got any kind of heart symptom, so that is what dictates the next further evaluation and treatment. So there is no particular age to which you are supposed to do a heart screening. Now, as you are all aware, with the current stressful life, with overambitious world full of expectations, and overstressing leads to overthinking, leads to undue stress. We need to take some measures in order to maintain our health, in particular the heart health, because cardiovascular disease contributes to significant amount of morbidity and mortality in the world. Now, previously we used to think that heart diseases are mainly seen in the elderly population, but with the current generational trends, we are seeing that the heart disease is very commonly seen in the younger population as well. And the thing is, there is no particular age, but the bottom line would be, like, if somebody who has a heart symptom or an early warning sign of a heart disease should consult a doctor and get himself or herself checked. I would suggest that people around 30 to 35 years of age are in the borderline age group, but above 35 in India, because we are all genetically prone to have heart disease in a younger population. So I would suggest 35 should be the age from where on we should start screening for the heart diseases.
But sir, a lot of people have regular chest pain Like, how do we differentiate that this is a heart attack and this is just a normal regular chest pain, sir?
There is a textbook description of how a patient of heart attack presents to the emergency, to the hospital. So usually they would be having, it is not actually pain, but it is a kind of constriction sensation or heaviness in the head. Some people describe it as some elephant sitting on their chest, that kind of bad feeling, or it could be a severe burning sensation. And this chest pain of heart origin usually radiates to the arms. It could be the left arm, right arm, or both the arms. It could radiate to the upper back. It could radiate to the jaw and throat. Actually, the word what we use to describe chest pain of heart origin is called angina. Angina means choking. Actually, it's not pain, but choking sensation, either in the chest or in the throat. So this is the common, and this chest pain characteristically happens when somebody walks for some distance or does some heavy work or does some activity, and it subsides with rest. But the chest pain of heart attack usually occurs at rest, and it won't subside without appropriate and timely treatment.
So, how to get heart checked? Like, I might have a heart attack. So, what are the things that I should go to check to a hospital, sir?
Heart health check begins with the consultation with the expert. So once the cardiologist or physician sees the patient, so they are going to decide based on the patient's symptomatology on what test needs to be done. So the common tests that are advised for evaluating one's heart or ECG, that is an electrocardiogram, an echocardiogram, that's called as a heart scan, then a stress test or called a treadmill test, wherein the ECG is connected and the patient or the subject is made to walk on the treadmill. Then there are some other tests like chest X-rays, some blood works like cholesterol, hemoglobin A1C, that's the glycosylated hemoglobin to diagnose diabetes, and there are advanced tests like CT coronary artery calcium scoring, CT coronary angiogram, or a myocardial stress nuclear scan.
How many times we have to exercise to keep our heart healthy, sir?
There is no definitive prescription of exercise, but as per the heart health body guidelines, like American Society of Cardiology or American Heart Association, American College of Cardiology guidelines says that at least 75 minutes of intense vigorous aerobic exercises in a week or 150 minutes of moderate aerobic exercises in a week. So what I would suggest is every small step, like some people say that at least you should walk 10,000 steps a day. So every small step uh, per day, actually adds to the cumulative effect of a positive impact of exercise on our heart and our health. So keep exercising regularly. It could be yoga, it could be hitting the gym and doing some exercises, it could be running on the treadmill, or it could be swimming, cycling. So there are various forms of physical activity or exercise. So there is no particular level of exercise that is prescribed or the type of exercise, but keep exercising in whatever manner you are comfortable with.
So, foods to eat or foods to avoid for a healthy heart, sir.
Yeah, basically what I recommend to my patients in my routine practice is to avoid oily food, to avoid red meat, and to avoid the junk food or processed food or deep fried food. So these are some of the foods that you need to stay away from. The healthy foods include fruits, vegetables, particularly anything which is green is good for your heart and for your health. Then nuts like walnuts, almonds, and peanuts, and the limited amount of consumption of your oil usage. Yeah, in the preparation of food. So and salt, low salt diet. So avoid high calorie, high carb diet, avoid oily stuff, and avoid excess amount of meat. So anything in excess is going to be harmful. Same applies to the habits like smoking, excessive alcohol consumption, lack of physical activity. So besides food, these are other things that one should take care of in maintenance of heart health.
So, diseases of heart. Like, often people think that only a heart attack is the only disease of heart. So, what are your opinion based on that, sir? And what are actual diseases of heart, sir?
Yeah, with the current access to social media, and people think of heart attack as number one heart disease. But besides that, there are so many other heart diseases that one should be aware of. Hypertension, high blood pressure is one among them. Then heart failure, wherein the heart pump function reduces. Effective pump function cannot happen, and the patient comes with symptoms of heart failure, or it could be an enlarged heart, which also leads to low heart function and diseases of the heart, or it could be congenital heart diseases like the heart diseases which start right from birth, or it could be genetic conditions. Then valvular heart diseases, it could be due to infection, or it could be due to age related degenerative processes. So there are various forms of heart diseases one should be aware of.
There is a lot of controversy that if we eat the egg yolk that is yellow, that might lead to high cholesterol. So, what are your opinion on that, sir?
Yeah, I would suggest that egg white is definitely healthy. Egg yolk consumed in limited quantities is not bad. So there is no absolute rule that you should not eat egg yolk. The yellow part of the egg is also rich in proteins, and yeah, there is no total restriction on the intake of egg yolk.
Any healthy tips, sir? Like people who are staying in home, they don't have access to hospital. If there are mothers, there are sisters, if they have to take care of their elder or youngers, what are the simple tips you would give, sir? Simple, like inside home remedies.
So it begins with one is the healthy diet.
Okay,
So
healthy diet.
yeah, so if the homemakers are aware of the do's and don'ts of cooking, particularly with regard to the heart disease, so use limited amount of salt, limited oil consumption, and limited meat consumption. Avoid junk food or processed food. So like elders used to say, that the home food is the best food.
Correct,
Yeah,
sir, correct.
so the avoid the deep fried food, avoid these pizzas and burgers,
Okay, sir.
or whichever is rich in cheese and meat. So these are some of the things that I would recommend, and simple exercises even at home. You don't have to necessarily join gym or go to yoga classes. It's not necessary that you always do high intensity exercises to prevent any heart conditions.
Thank you so much for your
Okay.
information, sir. Had a glad day, and thank you so much for your valuable time, sir.
Thank you.
Okay, thank you. Have a nice day.
Thank you.
एंड आ जाते थे एक और बात, अगर आपको ये वीडियो समझ में नहीं आया तो मुझे बता देना, मैं इसका और सिंप्लीफाइड वर्जन सिर्फ की पॉइंट्स के साथ बना दूंगा सो दैट आपको समझने में आसान हो। एंड मेक श्योर टू सब्सक्राइब, क्योंकि मुझे जल्दी से जल्दी 1K सब्सक्राइबर्स हिट करना है और चैनल भी मोनेटाइज करवाना है।